It's a great office because we have specialists with many different backgrounds. And so, I am board certified in pediatrics and allergy immunology. I have 4 kids of my own, so I definitely treat a lot of pediatric patients. Your most common food allergens are going to be the peanut, tree nut, shellfish, eggs, milk, soy. Wheat is on there. We actually don't see a lot of true wheat allergy. We see a lot of celiac disease, but it's still on the list, and so we're cognizant of it. The peanuts, the milk, and the eggs are the ones that we really see a lot of with little kids, and so as people are doing early introduction of new foods, we want them to be on the lookout for things like hives or the vomiting that we talked about. Those are your most common symptoms of a food allergy. For food allergy, we know that 9 out of 10 kids with milk and egg allergy are going to outgrow those when they get older, and the age that they outgrow them can vary. We like to try to get them eating baked egg or baked milk if they're allergic to egg and milk, because a lot of kids that can't tolerate unbaked milk or unbaked egg can tolerate the baked form of those foods, but that has to be done through an in-office challenge. So if we can get them eating the baked egg, baked milk, over 90% of them are going to outgrow that food allergy. When you look at peanuts and tree nuts, shellfish I would include in that as well, only about 20% of those kids are going to outgrow that allergy. So that one sticks around a lot longer, is much more persistent, and that's why most of the oral immunotherapy and food allergy therapies have focused on the peanuts and tree nuts, because they tend to be lifelong allergies. Early introduction is now the recommended protocol to follow if you have a new infant in the house. And so we realized a few years back that we were seeing increasing rates of food allergies, especially peanut, but also the eggs and milk. And so a study was done at Johns Hopkins called the LEAP study. And to summarize it, they basically took infants that were at high risk for food allergies. So kids with eczema, kids with siblings that have food allergy are automatically at a higher risk of developing food allergy themselves. So they took a population of infants that were high risk and split them into 2 groups. Half of the group they exposed to peanuts starting at 4 to 6 months old, and that was 3 times a week, giving them a smooth, age-appropriate peanut butter that they couldn't choke on, of course, not a chunky peanut butter that they could get lodged in their esophagus or their trachea, and did that 3 times a week. And then the other group, they had completely avoided peanuts, and the group that avoided peanuts had much more peanut allergy when they went on in life than the group that introduced foods early on, or peanut butter early on. And we now think this applies to the other hyperallergenic foods as well, that we should be introducing small amounts of these on a regular basis to infants in that 4 to 6 month age range. Of course, you always want to do it in an age-appropriate form, something you're not going to choke on, and you want to look out for those hives and the vomiting, the signs of allergic reaction. Kids with eczema are definitely going to be more prone to getting food allergies, so those are the ones who benefit the most from early introduction. So I actually have a 4-month-old right now, and she has some mild eczema, so we're doing an early introduction. And I will just use a little bit of peanut butter on a spoon, and 3 times a week, we'll just give that to her by mouth. You can do it on your finger, and like I said, you want to do it about 3 times a week. In the LEAP study, they did use about 2 teaspoons. So that's a lot for an infant. You probably don't need that much, maybe a half teaspoon to a teaspoon 3 times a week of that food, slowly given to the infant. And of course, watching for any signs of allergic reaction will decrease the chances of that baby having serious, potentially fatal food allergies later in life. So again, the kids with eczema are the ones who benefit the most from this, because they are the babies who are more prone to have food allergies when they get older. Yeah, so the first step is diagnosis. So whenever there's signs of a food allergy, such as hives or vomiting, you really want to get that child in to be seen by a board-certified allergy immunology physician so they can formally evaluate what the risk is, because there's other things that can mimic classic food allergy. So getting them in, getting the diagnosis made is the first step. Once that's done, avoidance is a legitimate strategy, and it's something that's probably practiced the most, but more and more we are doing oral desensitization for peanuts, and other groups are doing it for other foods. And so we know that there are methods for gradually introducing a food to an allergic patient, if you start early enough in life, that may be able to decrease their chances of having a serious allergy later on in life, or even take away the allergy.